Pediatric Osteopathy. In this video, we're going to cover the 5 key skills that you need to treat babies. Now, the reason these are key skills is because if you're only just getting started or only seen a few babies, or if you've been in practice a very long time, these are still the key skills that will get you the real difference when you're helping those babies. And I know that because I've been treating for a very, very long time, and I'm still using these principles that I'm going to teach you here in this video. Now, another reason why these are key skills is because 2 of them you can actually practice without any access to babies at all. And that's why I love them, is because you get to practice on your existing adult patients. And that is so important if you're just starting off, or you've only got a few patients and you're lacking in confidence and you want to improve your skills, to improve your confidence, to enable you then to see more babies. Additionally, 2 more of these key skills you can actually practice very easily on a baby without being in that kind of treatment mode. So you could find your own baby or one of a friend or relative and just practice these skills, which enables you to close that gap to that ability to put that first treatment in place where you're actually charging for your services, because that's a big step, to feel confident enough to say, right, now please hand over some cold hard cash for me to help your baby. So what are these 5 key skills? Now, the first one is connection. Now, what do I mean by that? Well, that's that ability to know where that other person is, whether that's an adult or a baby, in terms of their emotional state, their mental state, and their physical state. So if you're treating adults, you already know about this. It's that ability to try and to connect to someone. It's like when they're not giving you a good history at all, they're like, yeah, and you're like, okay, let's stand you up and let's get some hands-on. Because you can always do your history whilst you're treating them. Does that hurt? Okay, have you had an injury in that area recently? Have you felt that while you've been working or driving? But that's a connection, that's realizing where that patient is, an ability to shift where you are to meet them. Because people come in different shapes and sizes, and this is no more different with babies. They're all the same size, but they come in very different packages. One has had a horrific birth. They're like, I don't want to be here. I didn't know I was signing up for this. And another one is like, oh my God, life. How amazing is life? You know, and they're just happy, happy, happy baby. So different. And so we have to realize where they're at in order to connect with them. And so you can actually practice that with your adults. You can practice that adaptation. Now, what it means is not just with that, recognizing, okay, I need to cut this short and talking and get on to action. But it's also when you're working with a patient, your hands-on skills. So you might feel that you're just going to wait a little bit longer. You're going to put a little bit more subtlety in what you're going to do. Let's say you're working on the neck and you'll say, right, rather than going to really work in here with a strong muscle energy technique, I'm just going to start with that and let it float into a little bit more of a functional technique, see where it needs to go. I'm going to listen, really listen to the tissues and get feedback and let the tissues guide me where I need to go, because the patient's innate intelligence, their healing mechanism is in this really intelligent system. And so I'm going to go with that. I need to put something in to kind of activate it, but then I'm going to go with that and let that guide me. Now, if you're already doing that with adults, well, great. But if you're not, look, that's going to help you with your adult patients. And then when you come to treating babies, you're already practicing that connection. Yes, you're going to need to do some training and adaptation to babies for their specifics, but you're already along the road of getting that first key skill with babies, which is connection. Now, our second key skill is the ability to control our own mind. And we might want to say mind and emotions, because there's 2 of them are so interlinked. Babies like people that are calm. If you ruck up your nervous system, or if mum's nervous system is rucked up, then baby will respond to that. That's just a primal response. Baby is not able to run away. They're not able to see behind them what's going on. They can't turn around and, oh, okay, look at that coming. So they're very sensitive to noise, and they're very sensitive to mum's nervous system, but also other people's nervous systems as well. And so if you're able to control your own nervous system, and that doesn't mean being like this and I'm like, it's that ability to just to relax. It's like when I went to shoot this video, shooting video is a little bit nerve-wracking. So I have to kind of, forget about the fact you're on camera, which is very difficult when the camera's in front of you, but just try and forget about that and go into my natural state of teaching, because I love teaching. So it's doing these little things that get you into your natural state of, you love healing, you like helping people. So let's get into that, and let's get out of that fear of like, oh my God, what if the baby cries? What if mum says something to me and I don't know the answer? A lot of fear around that. Now, of course, that's bound to happen when you first treat a baby. It's the unknown. But you can practice control of that mind and control of your emotions when you're with your adult patients. Also when you're outside clinic as well. But certainly when you're with those adult patients. And so again, it's that ability to have a little bit of silence. It can be very uncomfortable silence. That wasn't very long. Already starting to get uncomfortable. Silence. So are you able to be quiet and the patient's quiet? I'm a real talker, and so often I'll fill the space, those gaps. Those gaps I'll fill them with talking about what I'm doing with the patient. I'll comment on what I'm doing this with the leg or the hip or whatever. So learning to be quiet is a great skill because it enables you to tap in a little bit more to what's going on. Oh, I'm feeling this. Let me let go of that. A little bit of anxiety. Let me let go of that. Because with an adult patient who's carrying their own emotional load, that will help you treat them. But when you're treating a baby, it is so crucial. When you put your hands on a baby, if you're like really anxious, baby will often pick up on that. Which is why you don't want to be putting your hands on their head start off. You don't want to be treating that. You want to go somewhere less sensitive, sacrum, feet, whatever. That's a really key skill. Learning to control your emotions, your mind, and learning to relax a little bit whilst you're with baby, and learning also about your intent. Because there's two things here. There's one that's being like a bit anxious and a bit jittery. Let's get rid of that. But there's also the ability to know to how much intent you put in. Now with another adult, your intent can scare them, but they're an adult. So often, unless they've got big emotional issues, post-traumatic stress disorder, things like that, you often have a lot of slack there to play with. With a baby, it's less so. You're big, you're scary to them, and so your intent, even if you're incredibly light with your hands, and I see this a lot with beginners, they're like so super sensitive. It's like touching a butterfly. They're being told to just, really just, slide your hand in, hardly touch at all. And that's fine, that their hand is really light, but their intent is like super strong. Either super strong in or super strong withdrawn out. Well, neither of those are going to work particularly well. So it's again comes back to that connection, that key skill one. It's key skill number one, learning how to connect at the right space, the right level, and then adapting your intent. It's like the focus on the camera. Too far in, it's going to be blurry. Too far out, it's going to be blurry. So we need to match that as well. And you can practice that with your adult patients. You don't necessarily need to be with a baby to do that. You can practice with that adult first and then get more confident before you start on those babies. Now the third key skill is transitions. Now transitions, you are going to need a baby in order to practice this. However, the great thing is you don't need to do that in a treatment situation. You can practice this on your own baby if you're lucky to have one, or if not, on a friend or relative, something like that. Now the thing here is what we're doing is we're learning the different positions that we can use with baby during treatment. Because when you're with baby, they're not going to just lie there. Well, actually occasionally they do. Occasionally they just come in, they're asleep, you put them down on the bench and they just lie there for 20 minutes and then go out. It's like they never knew they were there. But you can't rely on that, so you need transitions. So we need to transition between different positions before baby gets too cranky, because babies have short attention spans. So the different transitions you need to learn are supine, knee to knee, seated, standing, prone, over the shoulder, standing floating, feeding with mum. So lots of transitions, and they are so crucial to success in treating babies. Now you saw them there, so just for those clips you could go and practice those in terms of if you had a baby. So if you want to treat babies, then I can't emphasize more. Practice these 3 skills. Also, because you can do them for free. You don't have to pay for any training course. You don't have to do anything like that. I encourage you to do a training, certainly, but it means you can get going beforehand and see if you actually like this. See if you improve. It's like, wow, this is great. Then you'll have the motivation, and then you'll be like, yeah, I'm going to go do some training. Right, key skill number 4, and again, you're going to love this. This is adapting your existing skills from treating adults to babies. And I'm going to give you an example. So what you can see here is we're working on the hip and a baby. Now, this is not rocket science. And I tell you what, a treatment like this can really help a baby. really help a baby. Not just help that hip, it can help the sacrum, it can help the low back, it can help their digestion, constipation, lots of different things it can help with. However, this is not a rocket science technique. I mean, you probably have done something similar with an adult. So think about what you do with an adult. Those techniques can work with babies. Obviously, we're doing that at a much more gentler, we're taking sensitivity here, we're not putting a huge amount of weight on, but it's still, there's a lot of key skills, not just your history skills, but your examination skills and your treatment skills that you can adapt to babies. So I want you to start thinking, there's just that little clip, start thinking about how you can do that. Now that's before we even come on to skill number 5. Skill number 5 is something you probably already expected me to list, which is cranial skills. Let's call this cranial osteopathy, cranial sacral therapy, biodynamic osteopathy, whatever word you want to use. If you're a chiropractor, you might call it sacral occipital technique. Now, these are key skills if you want to treat babies. However, and I want to emphasize this, the 4 key skills that we've already gone through, if you do those, and then additionally do some training in how to treat babies in terms of technique, then you're going to be able to treat babies even if you don't have cranial skills. Having said that, do I recommend you have cranial skills? Yes, I do. They're an important part of treating babies. But you can definitely get started without that. And what's more, if you do have cranial skills, it's essential that you do those other 4 skills that I talk about. And the reason being, you can be a really good, experienced cranial practitioner, and you start working on babies, and it's like, wow, okay, this is a bit different. Baby doesn't hold still. Baby's head is a lot smaller to start with. You know, there's a lot more sensitivity that's required. And at the same time, baby is moving around all over the place, which makes it much harder to be sensitive. So there's a lot of tricks of the trade, so to speak. I love, for babies that are moving, I love sitting them up, because then they're a lot more like, oh, I can see what's going on. And so they're less likely to move around. You can move your hands with baby. So look, my hands are still. They're moving in space. I should qualify, they're not still, they're moving. They're moving in space, but if there's a head between my hands in relationship to their head, my hands are not moving. You can lock your elbows in, these sort of things. Lots of different tactics you can use to help you adapt and let your cranial skills work on babies. Now, hopefully this video has really inspired you and put a fire under you to treat babies, because you've got 4 key skills here that you can go and do for free. There's no money involved whatsoever in this. 4 key skills that you can go off and practice. And that's going to really enable you to get better with babies. It's going to reduce that fear, because you're going to feel confident that you've got this, you can do that. I am confident that you've got this and you can do that. Why? Because I've taught lots of practitioners to treat babies. And I can tell you the thing that holds people back is fear. Fear is what holds us back. Fear of the unknown. When you practice these 4 key skills, you get rid of that unknown. And I just want to mention one thing here. Doing a diploma or a pediatric degree or something like that, yes, that will also get rid of some of your fear, but boy, that's going to be a lot more expensive, and it's going to take you a year or 2 years. Now, I'm not saying they're not good, they're brilliant, I'm not saying that, but I'm just saying, do the stuff that's free, for goodness sake, do the stuff that's free that you can do first to see if you want to do this. And then go, yes, I want to do more training. I so love this, I'm going to enroll on a pediatric course or whatever. Do these 4 first, and if you're a cranial practitioner, you've got that 5th skill already, you just need to adapt it. Now, where to after that? Definitely go and get some training. I have several training courses in Kindred Academy. You can check those out if you want. I'm not going to plug that more than that here, because it's up to you to find the training that's right for you. And this is an informational video. This is me just getting you and inspiring you to treat babies, because there's so many babies that are out there that need treatment, and that's what I want you to do. So I don't really mind what route you get there, as long as you get there and start treating babies, because if you're treating adults, I know you're capable of treating babies. If you're watching this video, I know you want to treat babies. So you've got the 2 ingredients that you already need already. So get out there, get going, and in a month's time, I want you to put something in your diary. In a month's time, you have treated your first baby, even if it's not paying. And you can do this. You've got this. Go for it.